Hello, my name is Amber Clark, and our topic is prevalence of Ebola virus disease among citizens in West Africa between the years of 2014 to 2016. For environmental variables, there are some factors that have contributed to the spread of the Ebola virus disease, and they are geographic areas, poor public health, and culture. Geographic areas because all of Africa has been affected by the Ebola virus disease, specifically rural areas and urban areas. Rural areas because of limited access to healthcare. So with that, patients affected with the disease have to travel long distance to a healthcare facility. And urban areas because of dense population. Therefore, it spreads easily to one person to another. And since Africa is still a developing country, there are many changes and limitations in the healthcare access. So to continue, there are poor public health. And the reason for poor public health is due to civil war that has been going on since 2014. And because of this, the healthcare infrastructure has been severely damaged or destroyed, causing delay in emergency transportation and communications. And because of the civil war, children and young adults are not getting the provided education needed to know about the disease. And since they do not know about the disease, they are not aware of why or when they have disease. And lastly is cultural. In Africa, cultural family bondship is strong, meaning they take care of their loved ones and provide the needs for the loved ones. And one of the common practices in Africa is burial practices. So within the practice, when loved ones die, they dress the dead ones and touch them afterwards to transfer power. And this is probably one of the main reasons why researchers think that Ebola is spreading from one person to another. It's because the corpse carries a lot of infections or contamination when not handled carefully. And since it's not handled carefully, it could also spread to other family members. Next will be temporal variations. And within that, you see there's a graph. And on the graph shows the seasonal trends of when Ebola virus disease is common. And that is through the months of December and June. But within the months, the month with the most prevalent rate of Ebola virus disease is March and May. And that is due to warm weather and dry seasons. And since the Ebola virus disease has been going along for a long time, for 4 decades, it is a pandemic disease. So with that, Africa as a whole has been affected with the disease due to borders, meaning people travel from one place to another with easy access. And also because there has been an incident of one individual who traveled from West Africa, Nigeria, in July 20th to Dallas, Texas, in September 30th. And lastly is human mobility. As mentioned earlier, it's when one person travels to one place to another. Next will be gaps in knowledge, and these are some of the reasons why researchers are struggling to find the actual cause for the Ebola virus. One reason is that it's hard to get accurate reports at the borders in Africa, meaning since it has spread to all Africa, it's hard to control the Ebola virus disease outbreak because it's new and mysterious. And since it's new, there's not enough resources or data and no actual cause for the Ebola virus disease. And since there is no actual cause, we can't have any prevention methods to prevent the spread of the disease, causing limitations. But even though there is no primary preventions or any kind of preventions that have worked effectively, one way researchers in healthcare can can determine or figure out the Ebola virus disease is to check bodies of the dead ones for any symptoms of the disease. So with that, if it's negative, family members can continue the traditional burial practice, and if it's positive, the researchers can take the bodies to the isolation rooms for further studies. So this concludes that researchers know what to do during a time occurrence, but does not know why it's happening or where it comes from. And since they don't know why or where it comes from, they need to expand their research and knowledge on the Ebola virus disease, meaning they need to pinpoint who the natural reservoir is, or who is causing the spread of the disease, if it's a person, an animal, or some type of bacteria. So with that, researchers need to increase their research to find a direct link to the Ebola virus disease. And one way they could do it, though, is public health surveillance. And since they have the public health surveillance, they could use that to kind of pinpoint areas that are affected more, and within those pinpoint areas, they could find more specific reasons why the disease is being spread. So to conclude it, the Ebola virus disease needs more research and knowledge. And the reason for that is that it's new and mysterious. And since it's new and mysterious, there are high mortality rates. So with the $100 million, if we do win it, we could use that to enhance containment or prevent from reaching a Black Death mortality rate of the increase in the disease, because Ebola viruses are known to show no mercy. Here are the references, and thank you for listening.